So now the three important structures I drew, or the organs. So this is bladder, this is uterus, okay, and this is rectum. So rectum is more posterior, bladder is more anterior, and the uterus and vagina is in the middle. Okay, and here there is a symphysis pubis, okay. Now I'm going to show you the reflection of the peritoneum. So this is parietal peritoneum that I'm drawing over here. The parietal peritoneum is now covering the body wall, then it's covering the bladder on its top, then it's reflected back onto the uterus, then it covers the uterus, and at the cervical level it goes down okay. So now okay, so bladder and the uterus, there is a nice pockets. These pockets formed by the reflection of the visceral peritoneum between the bladder and the uterus, and this is known as anterior cul-de-sac. And it is also known as vesico-uterine pouch because it is between the bladder and the uterus. And this visceral peritoneum covering the uterus, not covering the cervix. That means from the isthmus level, it reflects back onto the rectum, and it forms the another potential space. This is the bigger potential space. This is in between the rectum and the uterus, known as recto-uterine pouch or pouch of Douglas or posterior cul-de-sac. So this is posterior cul-de-sac or pouch of Douglas. Okay, so between the rectum and uterus, and also known as recto-uterine pouch. Okay, so this peritoneal reflection is important for you. Now look at here. We found my previous diagram. The posterior cul-de-sac is posterior to the uterus, anterior to the rectum. It is posteriorly, yes, it is posterior to the body. This is anterior, this is towards posterior. And another pouch between the uterus and the bladder more anteriorly. It is in there. Okay, so we need to remember this diagram. Okay, it is very important. Now I will draw another diagram of internal reproductive system in conjunction with the ovary, round ligament, ovarian ligament, and also with the fallopian tube. That's actually look like with the broad ligament. Okay, I will draw that diagram. Okay, remember this diagram too. Okay, so now this is vagina. This is known as fornix, vaginal fornix. Okay, and the posterior fornix is more bigger than the anterior. That's why the posterior vaginal wall is 1.5 centimeter longer than the anterior. Okay, so this is fornices. This is external os. This is CX canal. This is cervix. Internal os. This is Okay, so this is endometrium. Okay, and this is uterine canal. Let me draw it with the anechoic tube, anechoic, as if there is a little collection of fluid, just in order to show the uterine canal. Uterine canal or endometrial canal. So this is ovary, this is ovarian ligament. This is fallopian tubes, this is interstitial part, interstitial part of fallopian tube. This part is isthmus. This is ampulla. This is known as, this part is infundibulum. Infundibulum, and this finger-like projection known as fimbri. Fimbri is a finger-like projection. I showed you here like that. Okay, and it has a specific function to grab the egg after ovulation, to take the egg inside the ampullary part of the fallopian tube. Okay, this is ovary. Draw little follicles. Okay, so now we can see the complete parts of the female reproductive. This is fundus, this is body, this is cervix. So this layer, the outer layer, is known as perimetrium. And this is known as myometrium. And endometrium is there. So there are three parts of the uterus: fundus, body, cervix. And there are three layers of the uterine layer wall. That is outer to inner: perimetrium, myometrium, and endometrium. And there are three openings: the fallopian tubes opening, and the internal os opening, and the external os opening. And this internal os and the two fallopian tube opening, like this, it looks like a triangular shape. Okay, triangular shape. And this thickness of the endometrium is highly dependent on the menstrual cycle. So according to the phase of menstrual cycle, the thickness varies. Okay, we'll discuss those during the physiology. Okay, but as of now, this is the complete parts of the female reproductive system. Now, two things I didn't show you yet. One is the broad ligament, which is the peritoneal reflection from the parietal turning into visceral that covers the uterus up to the internal os or up to the isthmus. It's just like a blanket. These are two fallopian tube. This is fundus, this is body, and this is cervix. Okay, that blanket covers the fallopian tube, the fundus, and the body up to the isthmus. So fallopian tubes are inside the broad ligament. Why it is called broad ligament? Because this is the ligament, is the biggest ligament in the body, and it divides the pelvic cavity into anterior and posterior. And ovary is attached with the posterior layer of the broad ligament. They ask this question. Ovaries are attached with the posterior layer of the broad ligament. Now, this uterus is 50%, it is anteverted. That means it looks like that, is hugging the bladder anteriorly. It looks like that. And this position of the uterus is maintained by the round ligament. What is the two round ligament? The two round ligament is attached with the fundal area, both sides, and it goes through the inguinal canal and it gives insertion to the mons pubis. As a result, the uterus gets anteverted position because the uterus has a 4 position. We'll discuss those things. Very important. Anteverted, anteflex. Retroverted, retroflex. Okay, we will have a good lecture on it. Okay, so now you know the anatomy of the reproductive organs, and keep that in mind. This reproductive organ needs to be in position. Then what are the structures they help this reproductive organ keeping in position? The pelvic muscles along with the bones. Pelvic muscles, the lateral pelvic muscles, and the levator ani muscle, that is the posterior inferior part. There are a couple of muscles we're going to discuss. The obturator internus muscle, iliopsoas muscle, piriformis muscle, and the levator ani muscles. So these muscles sonographically we can see, and we need to see this, especially the iliopsoas muscle, that in transverse view of the iliopsoas muscle looks like a big giant ovaries. Sometimes piriformis muscles look like that, cross section of the, look like an ovary. And the obturator internus muscles, they actually are the support structure on the lateral wall of the bladder that gives the square shape of the bladder. And the levator ani muscles we can see posterior to the vagina and around the anus and rectum. It is a thick muscles. When we contract the levator ani muscles, it pulls the anus up. That's why its name is levator ani muscles. And it protects and supports the vaginal canal and the rectum too, and it is support, or it forms the bed for the pelvic organs. And the bones, the pelvic bones, we need to know the two hip bones, one sacrum and one coccyx. The two hip bone forms two different types of junction. Anterior, the pubic part fused together forms the symphysis pubis. Symphysis pubis is posterior to the mons pubis. Symphysis pubis sonographically produce lot of posterior shadow. And on the behind they form sacroiliac joint. There are two sacroiliac joints on the right side and on the left side, sacrum and iliac part of the hip bone. And the coccyx and the tip, at the tip of the sacrum. Coccyx, there are four small vertebrae. They, most of the time it is fused together and it is attached with the sacrum, tip of the sacrum. Okay, and this coccyx are attached by some ligaments with the cervix and also with the pubic bone. Okay, and the sacrum is a big protection from the back. The sacrum can have a different curvature. For the male and female, you will see the different curvature. In the female, it needs more curve because to accommodate the uterus and its gravid uterus. Okay, and sometimes the outlet of the pelvic bony aperture is smaller so that baby cannot go down, so they do the C-section. Okay, so a lot of things can happen, but at least know that what are the bones, what are the muscles, and what are the important ligaments. Those are the support structures for the female reproductive organs. Okay, so those ligaments, usually it gives the attachment with the bone and the organs. Bone and the organs. So uterine bone, uterus needs a support with the bladder, needs a support with the rectum. They are soft ligaments. They keep the uterus in position. Cervix is attached with the sacrum, with the ligament. Okay, so that is important. Cervicosacral or sacrocervical ligament and coccygeal ligament, coccyx and cervix. Okay, there's a ligament, they holds, and the round ligament, they are important, and ovarian ligament, they are important too. Okay, so these are the ligaments that you need to remember, even though we cannot see sonographically, but in order to keep the uterus in position, you need to know the functions of the ligament. Okay, and you will see in old days, or mom has multiple history of labor, so their organs are loose, and the position of the uterus can be changed, position of the ovary can be changed too. But keep that in mind. Anterior position of the ovaries are not good. That is an abnormal location of the ovary. Okay, and rest of the other position of the ovary is okay. Okay, so this is anatomy that you learned today. So we will discuss more in the other time about the physiology, and before physiology, the Okay, let me cover this two part. That is the position of the uterus. Okay, then I will cover the anatomy all over. Okay, I hope you are enjoying the lecture because I am making it more easy because I am teaching the anatomy along with the clinical importance. Sonographically, why do I need to know this? Because your patient will present this way and you have to determine, you have to find out, you have to point out who is this.